If you break a leg, you go to your local hospital where there will be a good orthopaedic surgeon who can fix your leg. That's very straightforward. If you have vasculitis, what do?
I'll never forget in my husband's eyes, he looked at me and I could tell he thinks I'm dying.
You start to ask yourself questions about, could we have identified this sooner? Could we have seen this coming? And even the GPs were baffled by it.
When Lauren Currie was just 13, her family started to notice that their normally lively daughter seemed to be prone to tiredness and unspecific illnesses. She was 15 when she died. The eventual diagnosis of vasculitis came too late for her, but her parents, Grant and Adrienne Currie, have turned the anguish of their loss into the driving force behind the charity they founded in their daughter's name.
It's almost like one of these drawings with the numbers on it and join up the dots. It's very easy for us now to look at it and see all the vasculitis symptoms at the time that were being presented. But unfortunately, the dots weren't being joined up to show an autoimmune condition.
Vasculitis is a group of around 15 conditions, but more than almost any other ailment, it's made even more frightening for patients because it often goes undiagnosed until too late.
Vasculitis is an autoimmune condition, a disease of the blood vessels. Because blood vessels are all over the body, it can affect all organ systems, from the kidney to the lungs, to the eyes, to the skin, to the joints.
In total, in a million of the population, somewhere between 200 and 300 of them will have vasculitis. So nationally, there are quite a number of patients with vasculitis.
Much of the problem stems from the fact that GPs encounter the symptoms of vasculitis so rarely that they don't think of it as a possible reason for the patient's condition. Patients can present with flu-like symptoms or symptoms of rheumatoid arthritis or kidney disease.
I'd started a really bad cough, which I just couldn't get rid of. And I went to the GP and it was possible chest infection, and it just kept going on. And then when I went on my summer holidays again, flying, cough got worse, the cold got worse. I coughed the whole time I was away. And then by August, my breathing started getting really bad.
Hello, Tracy. Hi. Come in. What we understand about autoimmunity in general is that some of us are born with this susceptibility, if you like, for our immune systems to short circuit. And if you're born with this susceptibility and then something comes along, typically a virus infection, but it could be a drug or some sort of trigger from our environment, that will then trigger off an autoimmune reaction.
But energy levels are just on the floor, really. And I've gone from someone working, say, 60-hour week to doing 35 hours, and that's quite a struggle.
Well, Lauren was referred for rheumatoid arthritis. After she had various assessments on this, it was determined that she had what was a reactive response to glandular fever, and it would sort of burn itself out over a 12-month, 24-month period. She then was having tonsil problems, so she had an operation to look at removing the tonsils, and that's what picked up her rhinitis. And then things started to sort of develop into a more advanced stage very quickly. She developed a cough that she couldn't really get rid of, which then led to sort of bleeding in the throat. To see your daughter being rushed into resus, to be hooked up to every machine known to man, and to be tested constantly for various things. We could see the pain that she was in, that when she went down to 10%, I think that's when we realised that within a matter of hours that we were going to lose her. And there's just an incredible pain that I can't describe.
The type of vasculitis that Lauren Currie contracted, Wegener's disease, is around 80% fatal if untreated, though it affects only 1 in 300,000 people. Yet the one key to the millions of people around the world whose vasculitis is controlled is that it was diagnosed early.
Time and time again, I was always given antibiotics, go away, antibiotics. And because I was a nurse as well, it presented as infective. That's exactly what it looked like. And eventually got to head one Christmas, and I woke at 4 o'clock in the morning coughing up fresh blood. And I knew then as a nurse, this is serious.
Vasculitis is very difficult to diagnose for 2 reasons. One is that the disease can present in so many different ways. Secondly, the severity of the disease is quite variable in that some patients present with just mild prodromal symptoms, whereas others present with really severe organ-threatening disease from the start.
When we're talking about vasculitis to medical students or to family doctors, what we're really trying to tell them is what situations should vasculitis start to appear on your radar. And the first one is patients who are simply unwell and are not getting better. So a patient has gone to see their family doctor because they maybe feel tired, they have a fever, they have a pain, maybe the doctor examines them and they have some additional wheezes and sounds in their chest, and they're given antibiotics. Now, most of the time that will fix the infection, the patient will get better. But if you have a cough, you're given antibiotics and it doesn't fix the problem, what you might call antibiotic resistant, that is a red flag.
Once diagnosed, vasculitis can be controlled. Patients can go on to live long and worthwhile lives. The effectiveness of today's treatment is largely the result of groundbreaking work carried out in 2 research centres, Addenbrooke's Hospital in Cambridge and the Institute of Medical Sciences in Aberdeen.
We are now quite good at treating the disease if we're getting to see the patients early. And if we have seen the patients early and treated them early and we monitor them well, then the disease doesn't progress much at all.
Because I'm on sort of a stable dose just now, and I feel it's actually under control. I'm able to get up in the mornings, I will do my yoga, I get the kids out the door. I try and put things in place and try and manage it.
We have 2 areas of interest. So we have a clinical research group, and they're involved in doing clinical trials on patients and in introducing new drugs into the treatment of vasculitis. And then we have a laboratory-based group, and they are trying to define some of the genetic causes of vasculitis, and they're trying to develop new blood tests which will enable us to diagnose and treat vasculitis more effectively.
We've come a long way in knowing how to treat and control vasculitis conditions. But these advances don't put vasculitis treatment in the same league as cancer or coronary disease, which are no longer the death sentence that they once were. Lauren Currie's mum and dad formed the foundation because they were very concerned about the lack of awareness, even within the medical profession, of this group of conditions.
The charity is a vehicle for us to cope with Lauren's death. It needs to be her legacy that we start a foundation and that we try to do the key things that we felt let Lauren down at that time.
It's given many of us hope and a focus and a belief that, that life can be good again. You can advise them, they can advise you. The fact that they're fundraising, doing their 5K, they're having the charity dinners. There's so much more, I think, that we can now do that will all help.
I think we need to get the public thinking more about vasculitis. So when they are having so many health issues that are seemingly unrelated but causing them a lot of problems, we need to be able to go to the doctor and be as familiar with vasculitis as we would be if it was meningitis.
Lauren put up a brave fight, but ultimately vasculitis won because it wasn't diagnosed early enough. The moment a GP asks the question, could this be vasculitis, is the moment this perplexing and devastating condition can be brought under control.